Welcome to Airway Answers, expanding your breadth of knowledge. My name is Nicole Goldfarb, and I'm a speech-language pathologist and certified orofacial myologist. And I'm here to help you find your airway answers. We're in this together. Let's do this. Hello, everybody, and welcome to Airway Answers. Today, I have Dr. Andrew Cohen with us. Dr. Cohen, thank you so much for being here.
It's my pleasure.
So we're going to learn about you and your journey and your philosophy and thoughts. I've seen you a lot on social media going through your own airway treatment and metabolic treatment. And it sounded so interesting that I said, I need to get this guy and talk to you about what changes you've made, what's going on. So first I'm going to do a bio and introduce you so everyone gets to know who you are and your specialty. Okay. And then we'll talk about all of your dental sleep medicine expertise and your own personal journey. So sure. Dr. Andrew Cohen is a family dentist in Jenkintown, Pennsylvania, right? You're in Pennsylvania?
Yeah,
all right.
Right outside Philadelphia.
Say it again?
Right outside Philadelphia.
Okay, very cool. And Dr. Cohen specializes in dental sleep medicine. Believing that clarity leads to the best decisions, he helps patients understand complex issues related to sleep disorders and provides solutions that positively impact their lives. Embracing the motto, I make suggestions, you make decisions, Dr. Cohen offers a collaborative approach that sets him apart in the field. Dr. Cohen graduated from Syracuse University in 1994 with a BS in psychology. 4 years later, he received his DMD degree from Temple University School of Dentistry. He completed his general practice dental residency at Abington Jefferson Health and earned a diplomat status in dental sleep medicine from ACSDD in 2019. Funny, Abington. My mom's from Pennsylvania and she's from Abington and went to Abington High School. Kind of funny, like random thing. And when I read that, I said, hey, I've heard of that place. So for Dr. Cohen is a top dentist in Jenkintown and a renowned across the country for his specialty lectures on sleep disorders, case presentations, photography, and comprehensive exams. In 2011, Dr. Cohen was appointed a visiting faculty position at the prestigious Spear Education. With more than 17,000 members and 700 more study groups, they are the industry leader in education and ideal business management solutions. Dr. Cohen's been asked to mentor dentists worldwide to help shed light on dentistry and open eyes to new possibilities. You're also the moderator of the online dental forum, Spear Talk, and contributes to Spear Digest, the organization's informative dental education magazine. Again, thank you for sharing your time with us today. I really appreciate it.
My pleasure.
So I know you just from like social media and your communication with people and talking about your journey. And it wasn't too long ago. And is that okay if I talk about some of the things you've posted? Because it's social media, so everybody can see what you're going through. So
Absolutely.
Okay, this is cool. So you said a few weeks ago, a post, this past Saturday was a 6-month mark from when you started your metabolic journey to improve your health. And I'm going to list what you said. I am down 40 pounds, which is awesome. That's amazing. In 6 months, is that correct?
Mm-hmm.
Wonderful. I am completely off of blood pressure medication, even better. I no longer need Prilosec as I don't have any reflux. My sleep apnea is gone and I'm no longer tired. You're a new man. That sounds the rebirth of Dr. Cohen. This is amazing. Okay. Then you said, I did this by monitoring sugars and reducing inflammation with a glucose monitor, reducing blue light, getting into the sun and resetting my circadian rhythm. This helped me work around my anatomic issues. And then you gave a shout out to Dr. Sarush Zaghi, Doug Sandquist, for opening my eyes to health. I'm helping more patients and giving more options because of my journey. And then you thank Dr. Michael Gunson for supporting your journey. And you said you were there in California at the darkest moment and cheered my decision to regain my metabolic health. And let's talk about this and your journey. So I guess I want to back up and talk about how you decided to become a dentist. And then how did you decide to go into the specialty area of dental sleep medicine? Was there an aha moment? It sounds like you had a personal moment. And was that it? Tell us all about that.
Okay. So My whole life, I wanted to be an orthopedic surgeon and go into sports medicine. At the 11th hour, I was shadowing an orthopedic surgeon, and he was literally writing my medical school recommendation. And uh, his phone rang. It was his wife, and she said, "What time should I expect you home?" And he said, 11, 12 o'clock. And I said, "At night?" And he was like, "Yeah." He's like, "Summertime, lots of injuries." And I walked out of there and I called my father, who was a retired periodontist, and I said, "This is not for me. I don't want to do this." And he goes, "Well, I don't want you making a rash decision." So I ended up applying to both medical and dental school. I got into both. So 9 months later, it was like decision time. And then I basically decided I wanted to go into dentistry because I thought that the life that it would make available to me, spending more time with my family, was really important to me. And that's why I went in. In retrospect, it was the best decision I could have made. Was not cut out for medicine, but it's interesting how along my journey in dentistry, my focus really is on medicine and helping patients get as healthy as they can be. How I got into sleep medicine was even more random. Well, not random, kind of heartbreaking. So I was struggling with where to attach myself in my continuing education. I had bad experiences with different programs out there. And my best friend dragged me to go to Spear. And within 15 minutes of hearing Frank Spear, I knew I was home. I liked the way that they approached patient care and really co-diagnosis, uh, very patient-centered care, which is something that was very important to me. And we went on this education journey together. We were practiced a half a mile from each other. We went to dental school with each other. We went on vacation with each other, had kids at the same time. And then unfortunately, he was diagnosed with multiple myeloma. And while we were going out to Spear, we would share a room. I had started to snore, and he was struggling with his treatments and the medication and really sleeping. So I made myself an appliance just to help me snore. I didn't think much of it. And I woke up the next day, and for the first time, I felt like someone pulled the wool, like the fog was gone. And I literally, at first patient the next morning was my pulmonologist, who is board certified in sleep medicine. And I told him what happened. And he goes, "I think you have sleep apnea." We did a sleep study, and I did. I had mild sleep apnea, but for me, it wasn't so much the sleep apnea that was a problem. I was so tired all the time. As a matter of fact, I actually fell asleep in the show in Vegas, a Cirque du Soleil. And
Mhm.
that's like impossible. I mean, it's like
Yeah.
visual stimulation out the end, but I just was always tired. So I dove in head first, which is very much like me. Um, and I learned everything that I possibly could. This is maybe 2012. And I started making dental appliances, and I started my journey becoming first I forget what the designation was at first. Um, I don't even remember. But then eventually I became a diplomat. Like you said, it was important to me to become credentialed. Not necessarily that I needed it. It was just more, I thought it would make it easier to have communications with the healthcare um, physicians, if they knew that I really was well versed in everything that was going on. Um, and then my journey took me to Jeff Rouse, and I learned that it wasn't just sleep apnea. Here's an appliance. There was an anatomic component that needed to be addressed. And I was like really thought I had the answers. And then I went out to the Breathe Institute. I studied under Dr. Zaghi and learning tongue ties. And he was talking about this whole different approach, more of a circular approach to how you can get into the sleep paradigm. And unfortunately, we did a sleep study. And I had gone from mild to mild to severe after doing a lot of anatomic um, treatments on myself, which I'm sure we will talk about. And really, I always knew I was a surgical case. And when I had the sleep studies, I literally called Mike Gunson and I said, "Oh my God, I'm desaturating terribly. I need to get in." And he literally scheduled me while I was on the phone in California to have surgery this past December, which I ended up not needing. And that's where I started my metabolic journey. So it was literally just this past June that I found out that there's more than anatomy. And I think we owe it to our patients to let them understand that there's a metabolic approach that is very important, as well as improving the anatomy, which is why I think a lot of patients fail. If they only do anatomy, there's a group of patients that aren't getting better. And I think it's because metabolically they have dysfunction. It's kind of my short and long of it.
Well, that's so deep. I have so many notes I've already written and so many questions for you. Couple things. First, it was like your fate to not take that medical school route, because by going that dental route, not only did you get the medical component, but you figured out a health problem that you were suffering from that you probably would not have realized had you gone to medical school, right? You probably would have been so sleep deprived from just actually doing all the surgeries. And then that's, sleep is not really addressed in medical school programs. So it's kind of fate that you chose that route, don't you think?
I mean, the question of there are certain things meant to be. I think there's opportunities that we always come across in life, and I'm a firm believer that we make the best decisions that we can at the moment. And there's nothing wrong with changing course 6 months down the road when you get more information. And as Dr. Zaghi said during his course, in 5 years, half of what we learn in education is going to be proven to be false. The problem is we don't know which half. Well, that's no more true than my journey. I mean, I went about doing everything that we possibly could, and I continually got sicker, and my body kept showing me, and I wasn't listening, and I was just trying to manage it. And that's my problem with healthcare in a nutshell. I think we spend too much time giving patients Band-Aids to try to manage a disease, chronic diseases across the board. And our patients want quick solutions, and nothing comes from quick. And I think we need to open up our minds to tackling a lot of disease from a preventive standpoint, and also giving patients options to start one way and maybe shift into another. And I think that's how we're going to get them better and actually fix the problem.
So that these issues with sleep disorders are so multifaceted. So I want to talk about that with you and the complexities. One thing to back up though, when you said you wore the oral appliance and just to kind of stop your snoring, didn't realize the severity of the issue was beyond snoring, which we know snoring alone can cause significant health impacts. But you woke up and you felt like the fog was lifted, or the what did you say? The wool came off, like you were very, clear-minded. And I know that feeling because I wore a CPAP for 2 years, and that was the same feeling I had. Might have been like the first night I successfully wore the CPAP. I was like, oh my gosh, I think I used to have brain fog and I didn't even know. And I just woke up and my brain was just clear. And you don't realize how bad you might feel until you experience something different. And that whole brain fog feeling, or that cloudy brain, is really a chemical thing that's occurring because your brain is not washing out those chemicals that are building up. That the brain wash occurs right when we get into deep sleep, and our brain can kind of cleanse through the cerebral spinal fluid toxins that have built up throughout the day from thinking and being and our brain working. And when you don't get into deep sleep, that brainwash doesn't occur. And that's what brain fog is. That's what you feel the next day when you're kind of not thinking clearly. And to experience the feeling of that going away is really fascinating. And so it was kind of neat how you said you felt that way. And I felt that same way when I wore the CPAP. I was like, my brain is clear. There's no brain fog.
Yeah. So I'll even go deeper than that. I think what I have found along my educational journey is that it's really going to a cellular level. Cellular function is not happening well. So if there's a buildup in, let's say, glucose, and the body doesn't use it, it gets stored to fat, and that fat goes into the cells, and that disrupts cellular communication across the body. So the body then is going to say, well, these cells aren't working well. It's going to start an inflammatory response to that that doesn't get turned off. So, what you're talking about, the drainage in the lymphatic system, happens most during REM sleep. And if you're getting woken up during REM sleep, you're not getting that wash per se. Go on it to a total body level. Your body's not functioning well because it's not communicating well. And that ultimately really boils down to your circadian rhythms off. So every night that you're not getting the proper sleep, every day that your day wake cycle isn't working well, your body's actual functions are deteriorating. And then, the studies that they've shown for people who are not in, who have circadian rhythm dysfunction, are everything that we see in chronic disease across healthcare. So that's where, right now I'm wearing, blue light glasses, and I wear them anytime. These are my clear set. I have an amber set when the sun goes down, because I'm trying to improve my melatonin production. You say I'm a new man. I'm a work in progress. There are things that I'm still working on to try to get myself better. I think I have a really good understanding of, how sugars are affecting me. And now I'm trying to minimize my blue light. And what's really hard for me is I've noticed I've taken a step back because I'm not in the sun anymore because it's so cold. And, as I mentioned Doug Sandquist, he's like, you got to get comfortable with the cold. I'm not very good at that. I did 4 years at Syracuse in undergrad, and I don't like the cold anymore, but I'm not getting the sun, and the body needs that. We've become a society that is so sun averse. We're told to fear the sun, and yet the sun has the most regenerative properties that we actually have out there. You can really heal yourself. And it's not about baking all day. It's about getting into the sun, seeing the light at sunrise, and 20 minutes midday, and 20 minutes at sunset. So I'm trying different things. I got a red light. I do a lot of red light therapy to try to get more of the infrared lights, and doing what I can. It's a process. I got a lot of damage that I have to overcome. But I'm on the right track, which is pretty awesome. And I think that's why I went through all the skeletal changes that I did. And I did MARPE. I'm 1 year and 1 month post getting my maxilla expanded.
Okay, so let's talk about that. So
yeah.
So first, you discovered with Dr. Zoggy at the Breathe Institute course that you did the sleep study around that time and found out your sleep apnea was actually severe. So what was your next step from there?
Okay, so I have to back up just a touch. So from 2012 to 2019, when I first heard Jeff Rouse, I was your prototypical appliance dentist. I made mandibular advancement appliances. Everybody got pulled forward 60 to 70%. And, I basically put it in and prayed that it was going to work for them. Then I started, I heard Jeff Rouse. I started incorporating nasal breathing, which is huge, and mouth tape, because I'm trying to reduce the amount of collapsibility of the airway. So I'm trying to steal a little bit from here and a little bit from there. And then it was, but I kept getting worse. So like I would be great in an appliance for a couple years. And then as I got another couple years older, I started getting high blood pressure, and they gave me medication and they said, okay, now you're fine. But I wasn't. I kept getting worse, and my reflux kept getting worse. And I just, okay, take more medication. And, you're starting to hear things about how the protein pump inhibitors have a lot of side effects. And I've been on them for like 35 years. And, it just, people just kept giving me another drug. Mm-hmm. And it just didn't seem right. But that's what healthcare, that's what they were telling me. Why would they lie? Well, not that they were lying, but there were no other options and that were given to me per se. And then I just was I couldn't, no matter what I did laser treatments on myself. I have a Fotona laser. I have a light scalpel laser. So I was doing non-ablative soft tissue recontouring. I started doing a little bit of myofunctional therapy. I will tell you, I'm terrible at it. My hygienist is a myofunctional therapist. That's my weakest part in my journey. And then my teeth started to chip. So I'm like, all right, well, you know what? I'm getting worse. Let's at least try expansion, because I heard Rebecca Backow and 2020 at Spear, and I'm very friendly with Mariana Evans. And I'm like, I'm going to do this. So November of 2024, I did expansion, and I opened in 6 days, and that was crazy. And then I had it removed the month before I went to Dr. 𝐃𝐈𝐒𝐂𝐋𝐀 course. So it was out for a month. So I was expanded and healed. And then we did it, and I could breathe amazing.
Okay, wait. So how much expansion did you get, and what changes occurred during that time?
Yeah, so I have a pretty bad deviated septum. So my problems are a deviated septum. I'm bijaw deficient, so both my maxilla and mandible are set back, and I was transverse deficient. So I opened like 10 millimeters between my centrals, or 8 millimeters, I should say, between my centrals, and 4.5, 5 millimeters at bone level. So I had I look like that Alfred E. Newman from Mad Magazine. I had a monster diastemer going on.
Which is the goal.
It was the goal.
Those who know we're jealous.
Yeah. It was the goal. I was, I don't know, they look hot, right?
Yeah, you gotta show that diastema.
Yeah. Well, I don't have it anymore.
Yeah.
So then I went to Dr. 𝐃𝐈𝐒𝐂𝐋𝐀 course, because, as I told you, my hygienist, I helped her and supported her myofunctional training with Sarah Hornsby. And I really wanted to give her an anatomic option for her patients that she was going to see. So I wanted to learn from who I thought was one of the best in the country, Dr. 𝐃𝐈𝐒𝐂𝐋𝐀, at his technique. And that's how I am. I'm a hands-on guy. I need to literally hold my hand doing the first one, and then I'm ready to go. And then we had, as part of the course, everybody does sleep studies. And, I was sure I was going to be good, because I never get a stuffed nose anymore. I can breathe all the time. It doesn't matter what position I'm laying down. I can breathe so well. So
was that just after the MARPE?
It was after the MARPE. Okay. It was almost immediately. As soon as I opened up, it just I was able to bypass my deviated septum. Okay. So if you looked at my septum, you'd be like, whoa, that is so messed up. But now it's completely clear on both sides. I have perfect flow.
More space.
So I'm doing great. I'm still snoring, but there's all that stuff in my mouth, so my tongue is set back. But now that has been removed, I'm still wearing an appliance, and I'm snoring a little bit. I'm using mouth tape, but I just expected it to be amazing, my
So
sleep.
after the MARPE, you were still wearing like a mandibular advancement device?
Yeah, I
Is
had a
that
temporary one in
okay,
that I
okay,
made.
okay, and you were
And
still snoring with that in?
yep, still
Okay,
snoring with that in.
yeah.
And I get the sleep study back in the course, and it was like a slap. I mean, to go from mild to severe, like I'm supposed to be better and I'm worse. And it was like, so like everyone was kind of shocked. And so they're like, well, maybe it was just a bad night. So they gave it to me again. And I was like, terrible. It
Now,
was,
when you had the first sleep study where it was mild, that wasn't just before the MARPE, like, you could have gotten severe before MARPE, right? It wasn't like the
I mean,
expansion.
I did a sleep study back in, my appliance broke in 2020. So in 2021 or 22, I had done another sleep study,
Okay,
and
and that was mild.
yeah, it was still mild.
And, when you did the sleep study with Dr. Zagi's course, did you wear your oral appliance?
Yeah.
Okay,
Well, the first night I did, the second night I didn't, and it
okay,
was worse.
yeah.
And it was a horrible night's sleep. Like I was totally gagging like the whole
And
night.
what do you think caused a change? Now, the change occurred, like, between 2000, you said, like, 2021, which maybe it was mild then and then more severe. What do you think happened throughout that time period?
Okay, so I can only ask questions. I don't
Mhm.
know. The question I'm asking in my journey of metabolic health, one of the key players in your metabolic function is mitochondrial. And your mitochondria is basically your energy source for your body. And the job of the mitochondria is to produce ATP or energy. Well, the mitochondria also produce ROS, which is what helps us when our body needs an inflammatory response, which is really important in like acute injury, acute virus, acute bacteria, something like that. But the problem is that if the body is responding or is chronically metabolically troubled or has dysfunction, that inflammatory response never turns off. And you get this chronic level of inflammation throughout your body. Well, it's known that if the mitochondria has too much oxygen in the body, it will start to siphon it off and increase your CO2 levels. So it's my question that I'm asking ultimately would be, is it possible that by me having expansion, it was too much oxygen for my body because I was so metabolically off that my body was pulling back on the oxygen? I don't know. And
Hmm.
so, and the reason why I would ask the question is, you know, MMA is like our best anatomic thing that we can do for patients. Break the jaws, move them forward. That is literally why I called my guns. There was no way I was going to live my life knowing that I was desaturating into the 80 percentiles with oxygen. I mean, that's just so bad. I'm going to eventually die from that. And I had no option at that. A patient has to do something if they're desaturating that badly. Um, well, what's changed? Like, if that's our best thing that we can offer, then why does some people who get maxillomandibular advancement surgery get sleep apnea again? If you fix the airway, if you fix the anatomy. And ultimately, I think it's because we need to also assist our patients in improving their metabolic health. So there are some patients out there who can fix themselves just metabolically. And then there's going to be patients who need a lot of help. They're going to need anatomic health. They're going to need metabolic health. They're going to need everything to help them to overcome whatever their issues are. So I think the reason why you talk about fate and destiny, I think why I decided to go through MARPE at 52 years old is so I could have this journey. So now I can share it with others and raise awareness that, hey, we need to be offering these types of treatments, adjunctive treatments to our patients, and give them the option that they may want to choose before surgery. Because not all surgery is great. We have their side effects, just like there's side effects to medications.
Yeah. So then what happened after you got that sleep study and you were pretty shocked? What was your next step?
Well, after I stopped crying,
Yeah, after you stop crying and well, and actually, one thing also about that, and then we'll go back to the next step is that systemic inflammation you talk about.
yeah,
We know a lot of sleep disordered breathing issues. There's an anatomical component that began in childhood, and most adults with sleep apnea had sleep disordered breathing in childhood, and it was undetected. And right,
right.
it's progressive. And they find even in children, there's heightened levels of systemic inflammation. That just everything you're saying just continues to speak to the fact that we need to identify and treat early. So our children are not on a path where as adults they're stuck with these decisions of jaw surgery, life-changing procedures, changing the metabolic health, feeling like you're like, I'm stuck. I have to try to erase things that have occurred, and some things might not be reversible, right? So it's just we've got to fix these things in childhood, identify and treat early.
So I'm going to even take it one step further. It actually needs to be the pregnant mother,
Yep.
because the mitochondria, if a woman is having a type of sleep disorder or inflammatory issue while they're in their pregnancy, they pass that on to the child. It's the mother's mitochondria that go to the fetus.
Yes.
And tongue ties happen during the prenatal stage. So it's a paradigm shift. When we talk about sleep disorders, I used to put up a slide in my presentations that would start with snoring. Okay, by the time you have snoring, you have chronic disease. You
Yep.
missed the boat. And we talk about what we can do for our kids. Our kids, we can fix their metabolic health and maximize their anatomy so easily with orthodontics. And it's just standard ortho, expansion, protraction. It's myofunctional therapy, getting their tongues in the right spot, making sure that they can get that proper seal for nasal breathing. Get them. Look, kids are gonna. I mean, I'm guilty of it. I gave my kid, an iPad just to make him be quiet. But if we're gonna do that, then let's get filters on them. Let's block the blue light. Let's, improve their circadian rhythm. Let's get kids outside again. I mean, when I was a kid, I didn't come inside until 7 o'clock at night. And I look at my son, he comes in, he spends all that time in his room, and I'm like, get outside, get into the sun. And during the summertime, how much better does he sleep? I mean, it's like night and day because he's outside all day. So, I think those are the steps that we need to start letting our pediatricians know. We need to let our pediatric dentists know. We need to let our orthodontists know that we can help them, but we also need to be informing our patients that we have to improve their health. Kids today are 13 times more, obese than they were 10, 15 years ago. And it's because of all the sugars in our diet and the processed foods. And I'm not trying to go off on a wackadoo, pathway here, but I'm living proof that if you make some changes, you can take a situation that is severe and make a huge difference. And I did it with heart. I mean, there's no one on this planet that loves pizza more than me. I mean, I could eat it every single day at every single meal. And my friend said to me, he goes, you have a choice, and he's like, you either get jaw surgery or you stop eating pizza. Okay, well, I found a better way. I found a way that if I know I'm going to eat pizza and I can see that my sugar levels are going to go up, I can do something about it in real time. And, patients get blood work once a year, right? And they get an A1C done to see if they're pre-diabetic. That is almost pointless because by the time they're diabetic, they have chronic disease. Their body's not functioning well. Their liver's not processing glucose well. Their pancreas isn't producing insulin well. They're already in dysfunction. We need to know in real time, and I'm a big proponent of a constant glucose monitor, and I literally have paperwork I give to my patients that I'm treating for sleep, and I tell them, we're going to treat this in 2 ways. At least you're going to have the information and knowledge of how to become healthier. And I give them recommendations for constant glucose monitors. And it's interesting how many of their physicians call me up and say, or tell the patient, you don't need this. Your A1C is below, 5.6. And the problem is you can be pre-diabetic for 15 years before it shows up on an A1C. And because you're looking at red blood, you're not looking at it in real time. You're not looking at the dysfunction because the body will try to compensate for too much glucose. So, that's what I'm trying to do. I give patients, links for blue light glasses. Just wear them. Put filters on your phones. Every little thing can help.
So after you cried, after you found out you had the severe, then is that when you got the glucose monitor? What were your next steps then?
Well, Dr. 𝐃𝐈𝐒𝐂𝐋𝐀 mentioned something about a glucose monitor. And my the first thing I did was call with Mike Gunson. And I said, okay, we need to schedule surgery because I'm not going to get a stroke. I don't want Alzheimer's. I don't want to have a sudden heart attack. So I need to get this fixed. And I called him up. And then I called my friend, Doug Sandquist, who'd been talking about metabolic health for a while to me, but I just wasn't hearing it. And, it was those two, Dr. 𝐃𝐈𝐒𝐂𝐋𝐀 and Dr. Doug Sandquist, who kind of showed me. Now, Doug was taking it from the standpoint of light and the sun, and Dr. 𝐃𝐈𝐒𝐂𝐋𝐀 was mentioning getting your sugars under control. So I'm like, well, you know what? Let me see what's going on. My weight had been stable for 15 years, but let me see what's going on. And so I ordered it from California, and it was there when I arrived. And 2 weeks after I started getting my sugars in range, I stopped snoring. 2 weeks later.
What did you notice with the glucose monitor? Did you notice you were having major spikes and depressions?
Oh my God, it was horrific. I mean,
really?
I would go from, my sugars, like my baseline sugar was like between 120 and 130, which is kind of high normal. I personally think you need to be below 120, but a lot of companies will say normal is considered a glucose level under 140. I would go from 130 to 210. Then I would stay there for like 6 hours. And then I would finally come down. And what really hit it was I had my sugars in line for 2 weeks, and I had 2 slices of pizza. And what I had learned is that if my sugar spiked, if I just did something like walk the dog, which I was doing all summer, just a slow walk. And my dog, it takes like 30 minutes to walk a mile. So it was not at a fast pace, but I used up the sugar that was in my system. One night I just had a lot of work to do, and I was preparing for a presentation I was doing, and I watched my sugar spike, and I just didn't have time to do anything. And I was tired, and I went to bed, and my wife said, and I use SnoreLab every night. And I woke up and there was a monster spike in my SnoreLab. I was just so like epic snoring. And I looked at my glucose monitor, and exactly when I was snoring was exactly when I was out of range. And as soon as I went back in range, I stopped snoring.
That's fascinating.
Incredible. So it just really rang true, the inflammation that food and sugars can cause. And, I eat whatever I want. I just manage my spike when I get it. It's just
okay. So so let's talk about your diet and what you do, but I have a personal story has a similar thought. When I was pregnant, I didn't know I had sleep apnea, and I had in the form of upper airway resistance syndrome.
Yep.
So my oxygen wasn't dropping, but my heart rate was going at like 110 all throughout the night. But I didn't know that up until recently. So when I was pregnant, I didn't know. And I'm a runner, so I'm athletic, not overweight. But when I was pregnant, I started getting really like tired, and I'd eat like cereal or something that was very carb loading. And because I love my carbs, I love sugar, crave sugar, right? And I would just crash. Like I couldn't even keep my eyes open. I couldn't even see straight. And I told my doctor, I was like, I think I have like diabetes or something. Like I am like almost feeling like comatose. Like I'd have to lay down. I couldn't see. And sure enough, I was like 1 point off on the diabetes test that you do when you're pregnant. But then every week it started getting worse and worse. So I had to do insulin injections the last like 3 months of my pregnancy. And it was hard. The time my sugar could not stay under control was the morning sugar level. Now, nobody thought like, oh, your breathing and your sleep quality is probably contributing to that. But every morning my blood sugar would be really high, and I followed every rule and guideline, because when you're pregnant and you're diagnosed with gestational diabetes, you have to keep a journal and you have to write everything you eat and take your blood. Then it was like a finger prick test after you eat, and you have to meet with the dietitian. It was at least once a week and go over everything. And I remember they'd like look at my blood sugar monitor and what I wrote in the journal and what I ate. And she'd say like, well, what size was the tortilla? And she'd bring out a plastic tortilla this size and a bigger, like it was like they were really conscious of that. And I was the only person in the diabetes class that was not overweight, like significantly overweight. And I'm like, this is just so weird. Like, this doesn't make sense. Well, later I come to find out years later that I actually have sleep disorder breathing. And that was most likely the cause. In pregnancy, we see that blood sugar regulation problem. Gestational diabetes is highly correlated with sleep disorder breathing during pregnancy. And so it was just fascinating to see, because when I would take my blood and check my blood sugar levels, I could see like what I ate and how it correlated to the blood sugar spike. And they said you must exercise after you eat. Go for a walk. I ended up the weirdest thing. I got boxing gloves. I was the hugest pregnant lady ever. And I was in like Ross, like the store Ross, and they have boxing gloves. I got boxing gloves and I just started like boxing in the air, which really helped. And I found when I would eat, if I kicked my legs back and forth as I was eating, just swinging my legs nonstop throughout the meal, my blood sugar would be regulated more. And it's just really interesting how the movement is so important, and exercise and walking and moving our bodies. And I remember there was one night I was wearing like a cute dress, hugest belly, put on my boxing gloves, and I'm just trying to work off the meal. I had sushi, and that was like the worst white rice.
Nice, killer.
I'm like,
Yeah.
oh, it's just a little rice and sushi. No, that shot my blood sugar so high. And so I'm boxing, and my husband has his hands up. It's like the weirdest time in my life when I think about it. I'm trying to just like work it off. And I was like, well, why don't you take your blood to my husband? So he did his, and his blood sugar was so high. He had no idea. And
Yep.
that's when we found out he's pre-diabetic. And that led
Now,
this whole family thing.
now imagine having it in real time where you don't have to have a finger prick and you get notified that your sugar's starting to go up, and now you can do something about it and you can prevent that damage. And
This
yet,
sounds so important. I want to do this, and I'm going to feel really guilty because I probably am having massive spikes all day because of the foods I eat and some of these sugar cravings. So tell me what you do. You didn't change your diet?
well, no,
Okay.
oh, no, I did.
Okay.
So what I eliminated a lot of carbs,
Okay.
and so I got the constant glucose monitor from Signos, which I would highly recommend because their app is awesome. And you're logging foods, you get notifications. It gives you a lot of knowledge. So, for me, knowledge is power. And if you know what's going on, you have the ability to make choices. And I think that's what we have to stress upon patients. Like, make a choice. You're saying yes to something, right? Yeah, you had mentioned in my bio, like I make suggestions, you make decisions, which, I'm a big Peloton guy, and Dennis Morton is like the guy I like to ride with per se. And that's like his saying that, I use in everyday practice. So my sugars were so messed up. I mean, I used to have like full on pasta meals or, eat pizza, and I just had to make changes, and I changed the order in which I ate. So, a lot more protein, salads, my carb vegetables were more at the end. And then eventually, once I got into, control, I went, I would have, 1 cup of pasta instead of having an entire, 2 plates of pasta. Or I eliminated sugar at, the cereal, which I'm a huge Cocoa Crispy guy. And, I would have Cocoa Krispies at 8:30 at night. I mean, like, why did I not know? I mean, I knew it wasn't good, but I didn't know what it was doing to me. And then, as I got more in control and my glucose levels stabilized and I was in range 94, 95% of the time, I would eat, I would see what foods would do to me and in real time, which is the best part of a constant glucose monitor. So I found out actually pizza is not as bad for me because of the cheese that's on it. And if I eat protein before I have the pizza, I can still have 2 slices. I'm going to go up, but okay. So then I walk the dog, and then it goes up and then it comes down, and now it's managed, and my body used up that sugar in real time, because it takes 2 hours for the most amount of sugar to enter into our bloodstream. So it's really, we eat and then we get on to doing other things in our lives. And if we don't get that reminder of what's going on, if we don't see, I mean, my sugar is attached to my watch and my phone, I can just look at it and say, okay, I'm in range, I'm good. And then I can go about my day. It's just to see it. I don't have to go look for a finger prick and to see what's going on.
So much easier now with the constant
Totally.
glucose monitor. And does it alert you on your watch when your
Yeah.
sugar is okay?
Yep. Now, I committed to Signos for 6 months, and I just finished with them. And because now I have my knowledge and I don't need to log my foods and I really understand things, I switched to Stellos, which is less expensive. But
Okay.
what I'm noticing is there's nowhere near as much information. If I was just starting the journey, the Stellos would not be beneficial enough for my personality type. I want to be able to log those foods. So thinking of it from a patient standpoint, they would have to have a second app like a MyFitnessPal or something where they could log their foods so they could see the correlation between the two. And it was just a real interesting journey. It was like every morning, my sugar would spike. Why? And, I started understanding how bad the light is in dental offices with all the LED and the bright lights. And as soon as I walk into the office and the stress, would knock my points up, while I was getting myself under control in between patients, I would just take a quick walk around the block and my sugar would just drop like a rock if I was, anxious. That's the power that I had, that I was able to change.
Yeah.
So food was just part of it. It was
Right.
also getting into the sun. And then now, really starting, I guess, the end of October, I started really saying, wow, how much is this blue light affecting me? My wife, who's an insomniac, I got her glasses. She's now sleeping through the night. It's really powerful. The changes we can make that are really inexpensive, but they're so hard to do. Because who wants to watch their food? Who wants to
Oh,
put on glasses? Who wants to, get out in the sun when it's, 30 degrees out? Well, the choice is to be sick. And if you don't want to be sick, then you're going to do these things. I did not want, as much as I love Mike Gunson, I think he's the best surgeon in the entire world, and he's a friend of mine. And I can't say enough about him. I can't say enough about Rebecca Backow. If I had the ability to try the metabolic journey before I did all of this expansion, I absolutely would have tried it. But no one told me. So that's why I'm here, to tell people, well, okay, well, there are some options. Am I saying that you don't need to do anatomy. Absolutely 100% no. I am not saying that. I'm saying that we can help our patients and give them options. And I think they both need to run side by side.
Yeah, I hear you're saying it's not just one thing. It's not just anatomy and it's not just function, like what we talk about in myofunctional therapy, but it's also the whole metabolic component, of course. And I also thought it was interesting how you said when like a patient might stress you out or you're having anxiety at work, you could see your blood sugar went up. And it's an interesting thought that it's not just what we eat, but our stress level and cortisol is actually cause insulin resistance.
Yep.
And when I was pregnant and I was monitoring my glucose, I broke my foot and my blood sugar was up so high the days when I was having pain from my foot injury. So pain, stress, anxiety is going to also mess with your blood sugar.
Yep.
So deep breathing, meditation, yoga, relaxation, journaling, walking, getting out into the light, everything you're talking about, that holistic health, the holistic part of health is so important. It's not just one thing. It's never just one thing. It's not just anatomy, although that would be so great if it was that easy, right? So I picture you in your office, a patient like stresses you out and you go in the corner, you're like, I'm doing 20 jumping jacks. Hold on. Hold on. Your blood, but you got
I don't do that, but I do turn my red light on.
Yeah, you're like,
that helps. That helps.
But if your watch beeps, you're like, my blood sugar's up. Everybody, let's run some laps around the office. But
Right.
It's really important, though, for people to know and understand that we really need to take care of ourselves in so many different ways because life is stressful. There's so much going on. We all tend to overwork ourselves. And when you know you have a problem like sleep apnea, that sometimes only adds stress. It's sometimes like if you didn't know, you might be okay until you have that heart attack or whatever. But then knowing you feel kind of a burden, like, wow, I know I have a problem. I've got to fix it. So all this stress, it's important to manage that aspect.
It's interesting. And that's, I just finished reading Casey Means' Good Energy. Awesome book. She spends a lot of time on foods and diet, which, as I've told you, I think there's more to that. But that's a lot of what she's talking about. Our bodies are giving us warning signs and we're not responding properly. We're responding by taking a medication to manage it, but we're not getting it better. So, if we want to fix our problems, we need to take steps. And actually, after Thanksgiving, I started contacting functional medicine and integrative medicine docs, because I need their help. I don't want to manage patients' metabolic health. I want to make suggestions, but then I want their own physicians to manage it. So I had to start reaching out, and it's been a great. They've been so receptive because they're already there. They already understand how their patients need to get healthier, and they're doing a deeper dive with some of their blood tests, and I think it's great.
So one of the best courses I took, I've taken so many amazing courses, but Dr. Goldfarb, right, sleep protocol, her course with the vitamin D and the B complex protocol is really amazing. So I just urge anyone who can take that course. That was very eye-opening. So let's talk about the next steps for you in terms of your journey and how your sleep is and your breathing. And after that, I also want to talk about how do you streamline this for your patients? Because I already feel like we give them so many recommendations, like go see the allergy doctor, go see the ENT because you have a deviated septum or you can't breathe well through your nose, go do myofunctional therapy, go do expansion. Like we tell them so much. Now adding on another component like the metabolic piece and go see a functional medicine doctor could be overwhelming. So I want to ask how you streamline that. But before, can you kind of wrap up talking about what happened to you next in your journey with the glucose monitor? And you noticed you changed your diet, you changed your exercise, stress level, the snoring stopped, and what else?
Okay, so snoring stopped 2 weeks later, and then depending on what I would eat, it would go up or down. 6 weeks later, I went from severe sleep apnea to moderate. And then at 2 months, I was at mild. So I kept doing sleep studies on myself. I noticed I did my blood pressure. I had a doctor's appointment because I had DICE done down at Penn, University of Pennsylvania, to see where I was obstructing, and my blood pressure was normal. And I hadn't taken medication, so my blood pressure. I'm not taking any more blood pressure medication, um, and I don't have reflux anymore. So, and if you literally looked at what I ate, you'd be like, "There's no way he's dieting." 'Cause I was not dieting. I
But
just
you
my
lost
body
40 pounds around that time?
and I lost well, my hit my 40th pound in December, yes.
So do
But
you think
not dieting. I
so this
cannot
is
stress
really
that enough.
fascinating. I
Yeah.
love this because dieting can sometimes sound very overwhelming, so managing the blood sugar helps with the breathing, the sleep, the inflammation, and the weight loss. So let's connect that.
Yep.
But do you think some of the sleep breathing issues, the apnea got better simply because of the weight loss?
Oh, 100%. I mean,
Okay.
there's oh, absolutely. I mean, you're changing physically the amount of fat in my body, and I'm changing the soft tissue anatomy. I mean, my pant I have to buy all new clothes because nothing fits. I mean, it's like I I'm legitimately down 5 sizes in pants just, in 5 months, 6 months. Um,
And you
which
didn't diet.
not a
You did change. Okay, so what's the difference between dieting and you did change, like,
I
carb
stopped
intake?
a lot of bread. For me,
Okay.
my vice
Uh-huh.
was, well, I backloaded all my meals. I basically just ate dinner for the most part. So I would just, like, gorge myself from 5 o'clock till I went to sleep. Um,
That's what you did for
that's
this
what I did before.
before. Okay.
Yeah, so now I was eating breakfast, lunch, and dinner, and everything was related around a protein,
Okay.
very low sugar. So, I found awesome protein bars and different shakes. And I looked at more of food for fuel per se.
Mhm.
I get excited to come home every day because I'm like a wannabe Italian. So I have my three big meatballs every day for lunch. And, there's still sugar in red sauce, but I learned what I needed to do, and I just didn't eat the pasta with it. And
Yeah.
then when I do have pasta, let's say it's at dinner time, I know I got to walk the dog afterwards.
Yeah.
And portion control the carbs, and eliminated a lot of the carbs that I was eating, the empty carbs, a bagel.
Yeah.
I don't do that anymore. If I had a deli sandwich, I would just eat the deli. I didn't eat the bread with it, or I would have one slice of bread instead of two. If I went
Mhm.
out to dinner and got a cheeseburger, I would eat one of the buns instead of both of the buns.
Sounds like
Those are the
almost
changes.
yeah. When I had the diabetes, the gestational diabetes, which I know I am at a very high risk of getting diabetes again as I get older, once you have gestational diabetes. But doing the nutrition classes, I was able to and taking my monitoring my blood sugar, I really learned like what you're talking about. And I had a guide, the dietitian, like giving me feedback, and they tell you what your menu of like how many carbs you should have, proteins, fats, with each meal. And oh my God, reading the labels on everything. But once you learn about it, then you learn
Easy.
what's okay. And it's
And it's not bad. And that's, in Casey Means book Good Energy, she talks about how much, of the fructose is in our diets, and that's addictive characteristics. And, I eliminated it. I drink a lot more water, and,
okay.
it's,
It's fascinating. Like, even you think like, okay, fruits are good. But I remember for the diabetic diet, a banana, you could have banana, but only a half a banana. If you want an apple, a small apple. Everything is um a lot less than what you would think. And
yeah,
it's
see, I didn't do that. I would eat the whole banana, and then I would just go on a walk, and I would be fine.
okay,
And
interesting.
that's the knowledge that you get when you can monitor it in real time. You
Oh
see
yeah.
that it's going up, you just walk. And literally, when I first started, my family knew we would have dinner, and after dinner, I would go out and I would walk around the block, or I would do the Peloton. And I don't do that, and I don't need to do it anymore. Now it's just short little things, but
Because you
um,
know what you can eat, that's gonna cause a problem.
yeah, and I'll still. I mean, we just went to an Italian restaurant. I was like, I have to get chicken Parmesan and spaghetti. And I literally, my sugar jumped.
Okay, do my trick while you're at the restaurant or eating dinner at home. Swing your legs back and forth. Nobody will see under the table the whole meal.
Yeah,
And
so you know why that happens? It's because every muscle contraction, you're getting your mitochondria to release more energy, and the energy is using up. And
Yep.
I mean, that's how simple it can be. You're exactly right. But learning about why that happens was really enlightening to me.
Burning the sugar off. Another interesting thing is you said you would like not eat all day and then have this massive dinner. And when I learned when I took the diabetes program for myself that you want to eat every 2 to 3 hours, like meal, snack, and you should never feel hungry.
Right.
And when I got to that point, it was about 2 weeks of like withdrawals from sugar and just being really moody and like crying because I would see someone have dessert and I couldn't have it. It was like a really, because I was like an addict to sugar when I had to go through that. But I would get angry when like my husband would be like, I'm starving, I need to eat, and get all moody. I'm like, why would you let yourself get to the point where you're hungry? And it's hard to not do that. But when I was pregnant, I'm monitoring, like I have a baby to take care of. Like that was that for her. But to have regular meals helps keep your blood sugar stable. And that's really important as well.
Yeah. I mean, and that's, you know, what I found is that what one food affects one person, it affects someone else completely differently. And that's why everybody has to go on that journey, you know, themselves. But you need something that's going to help you. And, you know, I'm a big proponent that if you deny yourself something, you're going to fail. Like, so I don't deny myself pizza. I just know that if I'm going to eat pizza, then I have to walk around the block afterwards, or I'm going to have disease at night. I'm going to become inflamed, and I don't want that. So that's my choice. And it really, I got to be honest with you, it's not hard. You just got to learn about it. That's it.
This sounds amazing. So kind of like summing it up, this constant glucose monitoring sounds so important for so many people to take that step to figure out how their blood sugar is being regulated, what's causing these spikes if people are having those issues, how that's impacting sleep. We want to monitor carbs, decrease our carbohydrate, know about the protein, fat, balance, fiber, exercise, get moving, get out into the light. How do you make these recommendations for the patients that you see where they might feel overwhelmed?
So, you know, my big thing is co-diagnosis. I show them, I don't tell them. So, you know, my consult is, you know, doing 3D imaging and photography. And then I sit down with the patient and I review it. And when you show a patient that their maxilla is completely set back and the bones are in the wrong spot and the soft tissue is out of whack and their sleep looks terrible and they have all these medical diseases, and this is why, they have a choice to make. I can either move the bone, I can work around the bone, or we can change your overall health and make you healthier. Which do you want to do? And then I let them answer. And maybe right now they say, you know what, doc, I want to do the laser treatment. Okay, fine. We do the laser treatment. And maybe they start to feel a little bit healthier and they start to feel a little bit better and they get a little bit better sleep. And then I say to them, okay, well, you know what? You know what would really also help you? Getting control of your sugar levels and getting them in range. Do you want to look at that? And I talk to them about that. No, I don't want to do that. Okay, fine. Then we got to make an appliance. And now I got to manage you. And let me figure out what type of appliance is going to work best for you. And then they start to do better and their scores are doing better. They're feeling better. They're sleeping better. And I say, okay, do you want to start to try to, you know, get things, do you want to make like some life changes? Yes. Now I'm ready to make some life changes. Great. Then I have other patients that say, you know what? I don't want to do any of that stuff. I don't want to put an appliance in my mouth. I don't want to do laser therapy. I don't want orthodontics. What can I do? Well, then you gotta improve your metabolic health. And then we got to see how you're going to do with that. Cause it takes time. You know, you can't fix someone's metabolic health overnight. Everybody's going to be a little bit different on how dysfunctional they are along the pathway. Some people need to get their sugars under control. Some people need to get their blue light under control. Some people need to get into the sun, and, you know, they're so sun deprived and light deprived. So, it's really coming up with that balance and giving patients options. And I find that as long as they can be held accountable, they can follow through. And that's really the problem that I have with medicine. They say, go lose weight. Well, how am I supposed to lose weight? Lose weight is me coming home from a stressful day and not eating what I want to eat. Well, how about you can lose weight if we just look at what you're eating and seeing what effect it has on you and seeing if that makes a difference. And for me, it was like, oh, I'm getting my sugars in control. I'm healthier. And oh, wow, I'm losing weight because of it. I mean, it was just peeling off.
Yeah, that's just like icing. So do you guide your parents with, or your patients with, the glucose monitoring and the metabolic journey? Like,
Yeah, I
help?
give them all the information. I give them
And this is
links.
part of your dental appointments, or do you have
It's part
special?
of my consult. Yep.
Wow.
So when they come back to review everything, review the anatomy, review the soft tissue, review any type of screening or testing that I've done, they're leaving that day with nasal breathing. They're leaving with mouth tape or some nasal dilators, mouth tape. They're leaving with information about a constant glucose monitor, blue light blocking glasses, circadian rhythm, and a pamphlet for myofunctional therapy.
Mhm.
And I do that all in 45 minutes.
And then how often do they come back where you're like, are you checking on or
Yep. So
reviewing results with the glucose monitor with
no.
them? No.
So if they have questions, I ask them. I literally, a friend of mine who has trouble sleeping, I looked at her phone because she's using the Signos after my recommendation. And, I'm like, look at all this that's happening. You're not entering your information correctly. And I helped her do that. And I linked her watch to the app. And so I provide assistance that I do follow up with them. They're coming in usually for some anatomic help as well. So there's follow up that way. But it's more, the app kind of gives them, if they do Signos, they're getting that help through the app and Facebook.
Okay, so the app will guide like the diet component, and
Yeah, it gives
okay,
suggestions and stuff like
that's it. And it's Signos. How do you spell that?
that. SIGNOS.
Okay, that sounds great. So, I mean, this sounds great, your journey and where you are now. So you did another sleep study, and these are like take-home sleep studies you're doing, is that correct?
Yes.
And it went from severe to mild. Is that currently
Oh
how
no,
you
I don't have sleep apnea anymore.
No sleep apnea.
Yeah.
Look at that.
Now, I'll
That's
still have an
amazing.
occasional night where I snore a little bit and I feel where I'm obstructing. So actually, when I go back to work on Monday, I'm doing another laser procedure on myself, which is always very interesting. When I do laser procedures on myself, my staff loves to video it and laugh at me. But
Oh gosh.
I feel like I'm getting a little loose in my soft palate, so I'll tighten that up and I should be good to go.
Do
But
your
I don't
myofunctional
desaturate at all anymore.
do your myofunctional exercises. You
I
can
know
do
I'm
2 on the
so
way to
bad.
work, 2 on the way home.
I
Hey,
know.
while you're on your walk, you're gonna do 100 suctions on your walk, okay? You could probably do that in 2 minutes, and then you do each exercise as you're walking around the block. It's really
It is
fun.
amazing though, when you do the exercise, you don't snore as much. When you get outside, you don't snore as much. It's so shocking to see how all these little things can make such a huge difference. And myofunctional therapy is a big part of what we recommend in the office now.
Yeah.
I'm so glad that we've brought that in. Well, I wouldn't say we brought it into the practice because my hygienist separates it. It's not part of me. I let her use my space, but it's her own business. But just having that resource available is awesome.
Yeah, it's so important to address structure and function and metabolic health, like you're saying. And it feels overwhelming when you think about it, but the way you just described how you present it to your patients actually is not overwhelming. It's like you basically said, here are options to help you. What would you like to start with? And giving them that one step at a time option, and they do something. And usually everything is going to help in some way, usually. So you feel a little better, you're sleeping a little better, you have more energy and motivation to try something else. I just that was a very calming way you just presented it, and it didn't sound overwhelming. You're
Yeah,
kind of there with your patient, one step
I
at a
ask my patients when we're done, like, "Are you overwhelmed?" And they say, "No, you like really explained it well. I get it. Like, there's things that I can do." And I'm like, "Bingo. There are
time.
things that you can do. I want to help you own your own healthcare, be your own advocate to getting yourself better."
There are
And
so many things you can do to help yourself. That's really great. I had a patient who felt a little overwhelmed with all the recommendations that I had for her. There were so many different things she could do. And I told her, I was like, no, no, this is exciting. This is great news, because she felt horrible. And I'm like, there are so many things you can do to help yourself. It would be, if it was reverse and it's like, sorry, there's nothing you can do, that should be upsetting. But
yep.
be overwhelmed in happiness. There is so much you could do to help yourself on your health journey, increasing your health span.
And that's, learning that the hard way about who's behind the people making our healthcare choices, between big pharma and the insurance companies, when they ideally want you to have chronic long-standing disease. That's how they make their money. And I have a problem with that. I really think prevention is important, and I think getting kids as young as possible is critical, because I was talking to Dr. Stanley Liu from Stanford the other day, and he's like, sleep apnea is like an annoying, inflammatory chronic disease that's almost impossible to fix once they have sleep apnea. And it's true, because the patient's just so damaged. So, let's get them when they're kids, just like you were talking about. Let's help the pregnant mothers. And I think we're gonna, it's an epidemic right now. So I think we can really help people out.
Yeah. And I like this. I'm going to use your saying or your lines like, what do you want to start with first?
Yep.
That's, I feel like, very manageable to approach a patient when you deliver a lot of information, recommendations, suggestions, than to say, so what do you want to start with first? It just gives them the power and is not overwhelming. And I really appreciate you for presenting it that way, because I feel like I tend to overwhelm patients at the end of an evaluation with like 10 suggestions. And I like how you kind of use that wording to streamline it.
Well, I think a lot of it is dentists and healthcare provider. Well, I'm not going to say healthcare providers, but let's just keep it in dental, are scared of the metabolic information because we haven't learned it. It's overwhelming. And, I think what I found is that you can really understand it pretty quickly. If you take it in small steps, and, I'm only 6 months into this and I have a lot more to learn, but I'm offering my patients so many more options right now, which is pretty awesome. It's
Yeah.
getting really dark here. So hold on one second.
Oh yeah, sure. Yeah, and as you're saying this, I'm also thinking like, um, hello, shouldn't our internal medicine doctors, our physicians, be prescribing? Hey, let's check your blood sugar. We know they don't do that in most cases because it's a very
Because
reactive healthcare system. It's
yeah,
not a
they're not being reimbursed, and
yeah,
that's a problem. And
right,
so that's why preventive medicine really isn't well funded, because
right.
it's a shame. And that's what I'm trying. I was talking to my marketing person, and she said, "Well, how are you making money off of this?" And I'm not, and that's okay, because my mission is to make people healthier.
Yeah,
And I had to figure out a way that I can introduce all of this metabolic health in a way that wasn't going to make me lose money. And it's me talking about it, sharing my journey, me talking about it each time they're coming back in, and giving the patient resources and say, here's where you go if you want to do this step. This is what worked for me. It may work for you. And that's how I'm right now doing it. And if I come up with a better way, I'll check back in with you and say, hey, here's a business model for you to
hmm
use.
yeah. Well, no, I think that's is really great, because it's your passion, your own journey that you experience is now causing you to help tons of other people, and you're spreading this information. And now I want to get this glucose monitor, and I want to check this out too. And I think it's really, really important. I completely understand where
Yeah, I
you're
had
coming
9
from.
of my patients sign up for a constant glucose monitor last month.
See,
9.
your personal experience speaks truth to so many other people. You've been there, you've gone through this journey, people have seen it, and that's how you spread this message. And in this sleep airway field, I feel like all of us are on this mission to help other people. There's not like, it's not all like a financial thing. It's like we're donating time. You being here speaking to me for over an hour on your own time on a Friday is I'm so thankful for that. So I really appreciate that. And I want to get this information out to other people so they can learn it's not just structure, it's not just function, but we've got to look at the metabolic aspect as well. And it doesn't sound that hard. With that monitor and the signals can help guide you, and you can see what's happening with your blood sugar. And that's a really important step in this whole big picture of our health and our breathing and our sleep. Thank you so much, Dr. Cohen, for being here and helping.
It's my pleasure. Anytime.
Yeah. Okay. Well, keep us posted. Maybe we'll check back in another, few months or whatever, see how you're doing and other suggestions or things you've learned from your own journey as well. Thank you so much.
It's my pleasure. Thank you.
All right. Take care. Bye.
Bye-bye now.
Thank you so much for joining this episode of Airway Answers. I'm hoping some of your airway questions were answered. Please feel free to give us a rating or a comment. And if you have any further questions, you're welcome to email me at nicole@airwayanswers.info or check out our site at www.airwayanswers.info. Thank you so much and join us for the next one.